All right, everyone, welcome back and welcome to week 4, module 4. At this point, you have successfully navigated through 50% of this course, and you deserve a moment of congratulations. So pat yourself on the back for jobs well done. Keep up the good work. So here we are in module 4, and our foci for this module is on mental health promotion for children, adolescents, young and middle-aged adults, and older adults, stress and mental health, I'm sure we can all relate, management of anger, aggression, and violence, crisis, grief, and disaster management, and last but certainly not least, suicide prevention. And I believe that the assignments that correspond with this module really will help you to successfully meet course objective number 8, which is to implement safe, effective psychiatric mental health care to diverse patient populations. So again, you have the guided lecture notes and the supplementary PowerPoints that correspond with these chapters in your textbook. Again, this is all supplementary material. Let's jump down to the assignments page. So again, you're going to have 3 assignments for Module 4. Module 4 Assignment 1 is a suicide competency assessment. Module 4 Assignment 2 is the ACE Primary Prevention Discussion Board assignment, and then the Module 4 quiz. So let me jump right down to the VoiceThread assignment. Please don't panic. I know there are a lot of words on this page, but we will get through it. So the American Psychiatric Nurses Association, or APNA, has outlined psychiatric mental health nurse essential competencies for assessment and management of individuals at risk for suicide. You will read over and review the PDF document that's attached right here. These are specific to mental health nurses working on inpatient units. They address competencies at both the patient and systems level. Then, choose your VoiceThread assignment based on your current practice area. So, if you currently work on an inpatient behavioral health unit, or you work in corrections and you work specifically on a mental health pod or segregation area, anything that's inpatient behind a closed door, say you work with juveniles, again, behind closed doors, even in a residential treatment facility, you're going to follow the instructions for this first option. If you currently work in an outpatient behavioral health setting, you have specific instructions right here. If you do not currently work in a mental health setting, no problem, no worries. Your assignment is modified based on your employment setting, and you have a specific set of instructions that is given for you. Now, please make sure that you identify which of these is appropriate for you and then follow the instructions that are provided. If I go into each of these in this tutorial, I'll be here for 20 minutes, and I bet you have better things to do, like get outside and have some fun and play with your dog and do all of those things. Here is the grading rubric for the VoiceThread assignment. Oops. Okay, and you will see that I have the rubric broken into 2 sections. So for nurses working in the inpatient or outpatient mental health setting, you have your own rubric here. And then for nurses in that third option that are not currently working in the mental health setting, I have the rubric here. Because the instructions really are different depending on your practice setting. But the instructions are here, so please use this rubric, depending on your practice setting, to guide completion of your assignment. It will be of huge benefit for you. Okay, any general questions about this assignment, please ask on the discussion board. You know that I'm happy to answer those for you. Okay. Here is probably my favorite assignment, and I certainly hope it turns out to be yours also. So this is Module 4, Assignment 2, Adverse Childhood Experiences, known as ACE, Kaiser CDC Study. Have you ever heard of the Adverse Childhood Experiences study conducted by the Centers for Disease Control and Prevention and Kaiser Permanente? Take 5 minutes to view a quick overview. So I want you to take a look at this brief 5-minute video, and then I want you to watch a TED Talk. And this isn't very long either. It's pretty short. And then I have some additional information that you will need to read. I have some other links that you can go to review a little bit more information. And then once you're done doing all of that, I have a challenge for you. Your assignment is to be approached from a big picture public health perspective. I am not interested in secondary or tertiary responses to the ACE study for this assignment. What I am interested in is primary prevention ideas at the systems level. Directions for the discussion board are found below. So for those of you who are unsure about secondary prevention, that's things like screening or early intervention. Tertiary means treatment after the problem has already occurred. Again, I am interested in you looking at primary prevention ideas at the big level. This is my favorite assignment because this is probably going to be the most challenged that you are during this course. Looking at things from a primary disease prevention model is very difficult for nurses, and it's a challenge, but it is something that we are called to do. You know, one of our main responsibilities is really health promotion and disease prevention, and so that's what I'm really trying to get at here. So by clicking on the discussion board, we can click here to launch. Well, let me go back. Sorry about that. So this is the assignment. Based on the videos above and the information contained in the links, identify one primary prevention strategy on a systems level. Think community-based, school district-based, state-based, legal-based, payer source-based, in addition to possible means of implementation. Your initial post should be a minimum of 300 words, not including scholarly references. Then reply to at least one of your peers' initial post, identifying potential benefits of the idea and also potential consequences using scholarly references. Your textbook is also always a great scholarly reference. Your reply should be at least 200 words, not including those references. Identifying primary prevention interventions is often challenging for nurses, in part because we lack training in health promotion and disease prevention. If this is a stretch, here is something that might help you. Think about primary prevention of deadly diseases like polio, measles, or even the flu. The first thing that comes to mind is vaccinations and immunizations, right? Now think about primary prevention of smoking. The first thing that comes to mind is mass media campaigns using TV, radio, billboards, and other means, right? How about pregnancy prevention? The first thing that comes to mind is sexual education or abstinence programs in public schools, right? Now, think about adverse childhood experiences. How can we, that's a collective we, inoculate against the occurrence, incidence, and prevalence of adverse childhood experiences? Challenging to say the least. So I'm really excited about the ideas that you'll come up with. Now, your idea does not need to be novel. You don't need to recreate the wheel. You may find a great deal of wonderful scholarly references that talk about this on some of the links that I had provided on that other page. And there are a lot of wonderful peer-reviewed scholarly research articles on what some communities have done to actually make an impact. So your idea does not need to be brand new, doesn't need to be thought up out of the air, but make sure it's a solid idea. Make sure that it is primary prevention and make sure that you have resources to back it up. Last in this module, you have quiz 4, which is delivered in exactly the same way as the other 3 quizzes were. So this will be nothing new. Again, just as a reminder, please don't click the begin button until you are ready to start. All right, thank you and best of luck during week 4, module 4.